Okay, today we're going to discuss my best friend, the Body Back Buddy. You can get these on Amazon. It's like you become your own little chiropractor. So you learn a lot of things when you come in and see your chiropractor, and you want to continue with that work either with dental rolls or with the Body Back Buddy when you're at home. You don't have to run to the chiropractor every time you have an issue. We can learn chiropractic, and the patients can learn chiropractic. It's not something that has to be done just by the doctor. It can be done by the patient. We need some way to grab on. One of the main problems we have is our shoulders are being hiked up by looking down at the phone, looking down at the computer. So you have this device, and you can have all these nibs on here and knobs on here. And there is a nice instruction booklet that comes with it. And there's a lot of ideas in there that I've never read. So I just use it like I'm working on you, but I'm working on me. And one of the main spots you can see is right there, right where that's touching there, that first rib. That's the first rib. And this makes an interesting little triangle right here. It makes it out of the muscle, which comes from here to the head to the shoulder. Then it makes it from the rib, and then it makes it from the vertebrae. So you got this three-sided triangle, and the nerves are going through that triangle. Now on this side, it gets really weird because it goes to the heart. So it can mess with your rhythm of your heart on that side. But you take the top spot and you just put it there and push down, and you try to relocate that rib. And I noticed Dr. Max, he's on Chiro to the Max. That's his URL for his YouTubes. He does a lot of pushing down on his patients with that first rib. He does a good job on that. And so does Dr. Ed and Dr. Brenda Mondragon. They all do. We've all been taught this adjustment to push down on that first rib. And that causes a lot of relief, just tremendous relief. Or you can work on the vertebrae a little bit. Now that gets a little bit more, whether you shouldn't do that, maybe the chiropractor should be left to do that. But the rib surely is safe for you to work on. And you can just push down on that rib. I'll go around, just pull down with the other hand. The other hand is pulling down. Sometimes I even get my leg up in that little hoop there and push down on that rib. Just wait for, just hold it and wait for a minute. And you'll get tremendous relief from pushing that rib down. You can do the other side. Find the rib and just push. That's what this little handle's here for, so you can push down like that. And I have broken one of these before. I've pushed down so hard that I've snapped it, but that takes a lot of force. Maybe in my younger days I did that just to see if I could do it. Oh, that feels good. But you can guide it with this one, and you can push down with it on this one. And you can learn all different little tricks with this. You can work on your low back that are longer. That's the more expensive one, and it's hard to find out on the Amazon page which one you're buying. I believe the cheaper one is the shorter one. If you're tall and you're long through here, get the longer one. It'll be a little bit more money. Don't try to buy the cheaper one because it's going to be a little smaller. I think that's a really cool tool. Have fun. Oh, don't forget to like and subscribe and all that algorithm stuff for me, please. Help me get this out, whatever I'm trying to do here, trying to spread this information. Thank you. God bless.